here because the CDC released the new autism prevalence rate of 1 in 59 American children. That's up from 1 in 68 American children reported only 2 years ago.
And in this report, we're reporting on autism prevalence among children born in 2006. In this report, the network is reporting that autism prevalence affects 1 in 59 children across the United States.
Can you give us your interpretation of the study, dispelling any myths and revealing the truth?
I can point to 5 things which were most important to me from this report. One, that across the network and in New Jersey, autism prevalence increased 20% between 2012 and 2014. 2, that this increase is part of a larger trend, that being since 2000, autism prevalence by this network has increased 150%. So this is a very significant change in what's a relatively small period of time. And 3, New Jersey, which is the state with the most comprehensive effort in surveillance, is showing autism at 3%. 4, even though many people speak about better awareness of autism, when we looked at, that is when the ADAM network looked at the age of autism diagnosis, we saw that it didn't change in the last 14 years. It's been approximately 53 months throughout this period. And if autism prevalence was affected by greater awareness, you would expect the age of first diagnosis or earliest autism diagnosis to decrease, which it hasn't. And finally, even though autism prevalence is equally distributed among Black, white, and Hispanic children, minority children with autism are still significantly underestimated in most of the ADAM network states. New Jersey was the first state to show that Black, white, and Hispanic children were equal to have autism, equal in their likelihood of having autism, while other states still show this to be a lagging phenomenon. The simplest thing to conclude, the most obvious thing to conclude, is that these estimates are not at all due to changing definition of autism. I'm still surprised how frequently the media reports that this could be due to wider definition of autism or changing diagnostic criteria. Throughout the 14-year period of doing autism surveillance, we've only used one definition of autism, and that's the one that was provided by the DSM-4. We never changed those criteria. So 0 is due to shifting autism diagnosis.
So if autism was 1 in 150 12 years ago and is 1 in 59 now, is that a good estimate?
It's good from the perspective of recording correctly that there's been a significant shift upward in autism prevalence. Pretty much every indicator, IDEA data from the NHIS study, data from the ADAM network, and other sources of population-based information show a significant rise in autism across the United States in the last decade to 15 years. We are also seeing that the increase in autism prevalence is pushed quite significantly by children with significant levels of impairment and with co-occurring cognitive impairment. So it's not just the slightly affected children that are making the estimates percolate upward. But I think it is important to acknowledge what's true, and we do have a true rate of autism at 3%, and we have seen a true increase of approximately 150 to 200% in the period since 2000. So these are important facts. Unfortunately, we can't provide an explanation. Autism is a true public health crisis. Autism prevalence is an urgent public health concern. And while awareness is important, we've had now a decade of great efforts to awareness. Now we have to take actions.